This just in. First aid responders were called to the scene this morning when a woman in her third trimester was found lying in the grass near County Road 210. Action 9's Susie Stevens is on the scene.
Thank you, Jenna. Quite a frightening scene here for mother-to-be Amanda Roberts this morning. Mrs. Roberts was struck with severe chest pain on her daily walk. Paramedics have rushed to the scene and have transported her to the local hospital. We hope to have an update as soon as Amanda is stabilised.
Hi there, Amanda. It's nice to meet you. I'm
Hi, nice to meet you too.
How are you feeling today?
I've been feeling much better, thank you.
Good, that's great to hear. We wanted to check up on you since the recent incident and go over your test results. As shown in your records, I'm sure that you are now aware that you have the disorder factor V Leiden.
Yes, I was just recently notified of my disorder. Does this relate to the incident somehow?
It shows here that you recently experienced a deep vein thrombosis in your leg. As was seen in your case, swelling was evident in the leg, which was brought to your primary physician's attention. Unaware of your factor V Leiden mutation, your doctor viewed this as normal, for deep vein thrombosis is quite common in pregnant women.
Although I'm aware of the clot in my leg, how does this relate to the chest pains I was having?
Many factors play a role in blood clots. However, pulmonary embolisms are most often caused by deep vein thrombosis. A pulmonary embolism is a clot specifically in the lungs, which explains your chest pain.
Amanda has recently found out that she has the disorder referred to as factor V Leiden. Factor V Leiden is an inherited blood clotting disorder due to a mutation in the blood's factor V protein. To further understand the mutation, we will briefly go over the steps of hemostasis. One of blood's primary functions is to deliver nutrients and oxygen to the tissues of the body. It does so by remaining in its fluid form, accomplished by many complex biochemical reactions. When there is injury or damage to a blood vessel, blood has mechanisms that repair the wound to stop blood from excessively leaving the body. This is referred to as blood clotting or hemostasis. The goal of hemostasis is to restore oxygen delivery to the tissues. In step 1 of hemostasis, the damaged blood vessels, endothelial cells, and platelets release chemicals that initiate smooth muscle to contract, causing vasoconstriction. In step 2 of hemostasis, platelets aggregate together, forming a plug that seals off the wounded blood vessel. This is referred to as the platelet plug formation. In step 3 of hemostasis, clotting factors transform blood from a liquid to a gel-like substance. This is done via platelets that release platelet factor 3, which cause enzyme reactions to occur. These reactions produce strands of a fibrous material called fibrin. Factor V assists in the enzyme reactions that form the fibrin. When enough fibrin has been produced, activated protein C inactivates factor V to stop the clot from becoming bigger than necessary. This step is known as coagulation. In step 4 of hemostasis, referred to as clot retraction, actin and myosin squeeze the clot to increase blood retention, drawing the damaged edges of the blood vessel closer together. Platelet-derived growth factor is then released by platelets, which stimulate new cells to be made, helping to rebuild the blood vessel wall. The last step of hemostasis is fibrinolysis, which is the chemical digestion of the fibrin mesh. This removes unneeded clots when healing has been completed. Factor V Leiden is fairly common, with more than 3 million cases per year. The disorder was named after the city it was founded in by Dr. Auwijn in the Netherlands just over 20 years ago. As a result, the genetic mutation usually affects those of European descent. The mutation causes a resistance to the activated protein C. Without activated protein C, the factor V clotting protein remains activated. This causes clots to grow larger than necessary and furthermore can block blood vessels. 2 tests can be done to test for factor V Leiden. The first is referred to as an activated protein C resistance test, where your blood is tested to see if it is resistant to an anti-clotting protein known as activated protein C. This protein helps control factor V, as we mentioned earlier. If your blood is resistant to activated protein C, then you most likely have a mutation in the factor V gene. The second test is referred to as a genetic test. A genetic test is often used to confirm the results of an activated protein C resistance test. The gene test specifically shows whether you have a mutation on the factor V gene. Amanda mentions the clot found in her leg, medically referred to as deep vein thrombosis. Deep vein thrombosis is often seen in pregnancy because hormone levels are increased and blood flow is slower due to the fact that as the uterus expands, it causes restriction of blood flow from the lower regions of the body. Due to Amanda's factor V Leiden disorder, she should be watched more closely, especially during pregnancy. Amanda is more prone to blood clots as a result of the mutation, and on top of that, she is pregnant, doubling her risk. Although there is no cure for factor V Leiden, treatments may include blood thinners or anticoagulants such as heparin and warfarin.